Welcome back, everybody, to another Medical Monks webinar. Today's topic is going to be about ostomy, health, and well-being. And I'm pleased to introduce Jeanean Bauer from Convatec, who's going to be joining us today. Hi, Jeanean.
Hello, how's everybody doing today?
Good. So basically, Jeanean's going to be presenting here today. As usual, if you're new or if you've been with us before, if you ever have any questions or anything like that during the webinar, please feel free to throw it in the chat, and I'll be monitoring it during the presentation. And then at the end of the presentation, Jeanean will be more than happy to answer any questions you guys have, and we can go over those at the end. So without further ado, Jeanean, you can take over.
Sounds wonderful. All right, so today we're going to talk a little bit about our ostomy, health, and well-being. So our agenda, we're going to look at physical well-being, emotional health, and then some support and products. Really today what we want to do is we want to gain more information and knowledge around living with an ostomy and aspects of that. We're going to talk about skin health and nutrition, both very important to ostomates. And then we're also going to cover some really important support programs and resources that are out there available for our ostomates. So physical well-being, we'll start off talking about stoma management. So stoma management, there's approximately 1 million people in the US living with ostomies. There are anywhere around 100,000 new ostomy surgeries performed every year. Many causes are cancer, infection, blockage in the bowel. There's inflammatory bowel disease, such as Crohn's or ulcerative colitis. There can be inherited conditions, such as familial adenomatous polyposis, congenital defect, and then unfortunately, sometimes we end up with an ostomy related to trauma. So there are 3 different types of stomas, and it's important to understand what type of ostomy surgery that you've had or what type of stoma you have. So if you have an ostomy and it was created in the small intestine, it's an ileostomy. It's in the ileum of the small intestine, and typically output is going to be more liquid stool. Second, there is a colostomy, which can occur in any portion of the colon, which is the large intestine. And that stool is going to be a little bit thicker to more formed. And then we have people who may have a urostomy. And a urostomy is created when they take a piece of small intestine and they actually suture the end shut like a tube socket. And then they suture the ureters from the kidneys to it to help drain the urine. And that little piece of intestine is what they bring out through the abdomen. And that is the stoma for a urostomy. So a urostomy is going to put out urine, so that is always going to be liquid. The type of whether it's fecal or urine coming out of a stoma is really going to determine a lot of times what we need to do to achieve a leak-proof appliance with a predictable wear time. So what are we wearing to make sure that we're not having leaks? Okay, so what does a stoma look like? Everybody's stomas are all going to look just a little bit different. Just like we are all unique, stomas are going to be somewhat unique, depending how they were formed and what the surgeon had to work with when they created them. So typically stomas are round. They can be a little irregular at times. That is completely normal. What we want for the stoma to be is we want it to be moist and we want it to be red. And it should be very flexible, so it will stretch and move as it passes, whether it be stool or urine. What an important tip, though, to remember is our stoma can change in size as we maybe gain weight, lose weight, but it also can change in size just throughout the day. So if you're passing urine or stool through your stoma, it can stretch and get a little bit bigger. You may find that if you sit down versus if you stand up, your stoma might change in size a little bit. Those are all very normal, but it's really important to make sure that we do measure so when we are placing a pouching system that we have the correct size and that we don't cause trauma to our stoma. Very important. How do I clean around my stoma? We want to avoid anything with oils, lotions, or creams around our stoma. The most important thing you can remember is to please clean around your stoma with warm water. Most soaps, lotions, baby wipes, moisturizers, those all contain things that can cause the barrier of your pouching system not to adhere to your skin. So really important that when we cleanse that skin, we use warm water only. If you have residue around, you can use a adhesive remover wipe to help get rid of some of those things to make sure your skin is nice and clean. We don't want you scrubbing too hard because that can irritate skin as well. But gently cleansing around with warm water, patting dry, and making sure that skin is clean and dry before we put the next barrier down of that pouching system is important. So why is it important for us to find the right appliance or the right pouching system for you? Just like everybody is unique and your stoma is unique, we all want to have different lifestyles, and we want to make sure that we are finding the right fit for you. Up to 80% of people will experience some sort of peristomal skin complication throughout their life with a stoma, whether that be for a short temporary period of time or if it's for a lifetime. So again, we really want to make sure that what's coming out of your stoma isn't ending up on your skin and trapped underneath that barrier that you're wearing. Other reasons some people have peristomal skin complications can be skin stripping, and that's if you take a barrier down too quickly, it can pull on the skin and cause irritation. And then some people just have an underlying skin conditions that can cause some issues. So we're actually going to stop for just a second here because I wanted to show you how to properly measure for your stoma. So I've got a little stoma board here. Hopefully you can all see my stoma board. What we want to do is we want to measure our stoma because we want to make sure that we get the right size. So this one would be too big. We would have too much skin exposed around our stoma if we cut our barrier to that size, where this would be too small. So what we want to do is find the closest size that's going to match our stoma, and this is what we're going to trace on the back of our barrier, like so. Once we have that traced, we want to cut it out. But then what we also want to do is make sure before we pull any back off that that's going to be the correct size for around our stoma. When you have a cut to fit barrier, you want to make sure that you have just a very, very small amount of space around your stoma because again, your stoma is going to change in size throughout the day and it's going to stretch when it passes stool or urine. So we want to make sure that you have just a little bit of space there for that stoma to stretch so this stationary edge isn't too close. Another option is actually a moldable barrier. So this is a scissorless barrier. And on packaging, a lot of times you can tell because they'll have either a scissors or you'll see little fingers for moldable. But the other thing that you can look for too is if you look at the back of this one, it has cut lines. So we know this is going to be a cut. With the moldable, we don't need to do that. We're going to hold this in our hand and we're going to gently roll, mold, and hold with our fingers to the size we need, okay? It's important to roll, mold, and hold because we want to make sure that we engage the 3 layers that are in this barrier to make sure that we get a good seal. Okay, so as we roll this back, we can go bigger. Then what we're going to do is when we know it's the correct size, we're going to check it on our stoma and we're good. Then we're going to pull the back off and place it around our stoma. The nice thing about moldable is that it actually comes back up next to your stoma and hug your stoma and move with it throughout the day. So those are 2 options that we have available in general for various pouching systems. All right, moving on. So nutrition. Nutrition plays a very big part in ostomy. Things we want to look at, foods. If you ate something before you had ostomy surgery and you had gas, it's probably going to cause gas and odor now. But choosing the correct foods is really important for you. So each ostomate is going to be a little different. There is no such thing as the ostomate diet. What you want to do is introduce foods into your diet slowly. If it's something that you haven't had before, you always want to make sure you chew your food really well and eat slowly. If we consume our food too quickly, that can actually lead to more gas and it can lead to some bloating and being uncomfortable. Foods, sometimes they can make your, for stool, they can make it a little bit looser or it can make it a little bit thicker. Foods can also change odor, especially for a urostomate. Asparagus is one that can definitely change odor of urine. So the foods we eat do make a difference, and we just want to make sure that we are enjoying the foods that we're eating, but then also making sure that they are the right types of foods for us. Medications, if somebody has an ileostomy that comes from the small intestine and they're on extended release medications, those medications don't have an opportunity to absorb appropriately. So that's just an example of a medication that can influence the absorption and if you have an ostomy. So that's something to keep in mind. But different medications will affect differently when you have an ostomy. So it's important to make sure that you are speaking with your healthcare provider about the medications that you are currently taking. Fluid intake, again, very important. For a fecal stoma, for an ileostomy or colostomy, we want to make sure that somebody has enough fluid intake, that they're not getting dehydrated or becoming constipated. And fluid intake is also very important for a urostomy because we want to make sure that we are having enough, again, fluid in the system and are not becoming dehydrated. Again, gas and odor. If foods were causing gas and odor before you had your ostomy, they're very well likely again. But again, things that we want to avoid are if a lot of carbonation, and again, those gas-producing foods. All right. So again, what to eat after ostomy surgery? Eat slow and steady. Slow and steady wins the race. So trying new foods, again, is not a bad thing, but try in small portions and make sure that you can handle them okay. Keeping a journal can be helpful, writing down what you've eaten. Again, liquids don't wait to hydrate. The best thing you can do is keep yourself hydrated. Urine should be kind of a pale yellow color. It should be odorless unless, of course, you eat foods that can cause odor. And everyone has different needs from day to day. They recommend on average around 6 to 8 glasses of fluid per day in an 8-ounce glass. Now, with that being said, depending on how much fluid intake you typically have, it will vary a little bit. So that's a general guideline. One of the other opportunities that we have with Convatec is our Me Plus recovery program. So Me Plus is a support program for all of our customers out there, and it has a lot of different resources that are available to our estimates. Me Plus recovery is one of those. So Me Plus recovery, is going to help us return to those normal activities. It helps us build confidence, not only physically, but mentally. Recovery program is gentle exercises to help build up those pelvic floor muscles and intra-abdominal muscles to make sure that we are being able to stay healthy. The Me Plus series, a recovery series, is actually in 3 phases. It can be started the day of surgery. So phase 1 is just gentle movements to help right after surgery for ostomates. It helps teach how to sit up, how to stand, how to take steps. It's very gentle movements. As you transition and as you heal, you can move into phase 2 and phase 3, and those exercises and movements just become a little bit more strenuous with each phase to make sure that we are re-engaging those core muscles in our bellies and staying healthy and active. Emotional well-being, understanding your feelings and relationships and intimacy. Having an ostomy is a very personal experience. At Convatec, we recognize that no matter what medical challenge patients are facing, everyone is on a journey and everyone's journey is different. So how we move through our journey is very personalized. So emotional health. Right after having ostomy surgery, it's something that really, it changes body image many times for people. Please understand there are many people walking around every single day, and you may have no idea that they have an ostomy. We have made great strides through industry and through clinical research to really make great pouching systems to help keep everything secure. Our pouching systems have odor barriers in them, so you should not smell things. And we've really tried to make strides in making things more concealed and discreet. But after having ostomy surgery, having feelings of confusion, sadness, and anger, frustration, those are all very common. But please remember, having an ostomy surgery is not a bad thing. Many times after an ostomy surgery, that diseased portion of the body or what was causing you to be uncomfortable before is gone. Many times it's a life-saving surgery. Having an ostomy shouldn't keep you from being involved in life. It should help you get back to being in life, being active, expressing yourself. How you express yourself is truly up to you. Some people are very open about their experience and they share about their ostomy journey, and others are not. Either is completely okay. The most important thing is that you find a way to get back to the best you and living your best life. Common questions we find: will I be able to participate in sports? Will my pouch leak? Will I be able to have sexual relations? What will my colleagues and friends think? Do I need a new wardrobe? Those are all very common questions. And I would suggest if you have an ostomy nurse that you can speak with about certain questions, that is a great place to start, because they can have those conversations with you. You should be able to do basically everything that you were doing before you had surgery, and sometimes even more, because if you were very ill before you had your ostomy surgery, now you may be feeling even better. Having an ostomy really shouldn't keep you from doing all the things that you love in life. So how do we talk to people about this? The first and most important thing is that you are comfortable with your ostomy and your surgery, and that you find what is working best for you. If you choose to tell somebody about your ostomy, that is absolutely fine. If you choose not to, that's okay too. Pouching systems have odor barriers in them, so you shouldn't typically smell them. However, if somebody has a colostomy and they feel that they can smell their ostomy a lot, there are deodorizing products and different accessories that you can find to help with controlling odor. And how you talk to things with your partner, that's, again, up to you. But if you have a relationship, it's important to share those feelings. All right. Support and products. Throughout industry, just in general, we have one piece and we have two-piece appliances. What that means, and I'm just going to stop presenting for just a moment here, is that this is a one-piece appliance. It means that this barrier on the back and this pouch is all connected into one piece. The other option is a two-piece, and that is where you have a barrier and a pouch separate, and those actually snap together once you get the barrier on your body, then you can snap the pouch on. Okay. So that's just a general explanation of the two types that we have. Throughout that, Convatec has a full portfolio of options of one and two piece products to really help you find the best fit. If you are having issues with leak, which is unfortunate, there is a solution out there. So between one and two piece products and a plethora of accessories available, you should be able to find the right fit for you. Again, remember, routinely measuring your stoma is very important. Over time, we want to make sure that you are getting the correct barrier and having the right accessories. So again, there is no such thing as one size fits all. So when you come out of the hospital, if you are a new ostomate, and what you go home with may not be what you end up with, it takes about 6 to 8 weeks for that stoma to heal to the size it's going to be permanently. With that being said, it might be 2 or 3 years down the road, or 2 or 3 months. And if somebody gains weight or lose weight, sometimes we need to reevaluate. But just know that leaks are not normal, and that if it's a regular occurrence, then we need to find something to help you fit your lifestyle better. The Me Plus Support Program is through Convatec and is a program for our ostomates. There are, again, many resources through the Me Plus, and we are here to support you throughout your journey. Starting with resources and education, once you sign up for our Me Plus Support Program, you will be sent a starter kit, and in that starter kit, they will have product samples and various accessory samples. They will have information on a recovery program to help you get active after surgery, and it will have other resources as well on nutrition and lifestyle. The other thing that we provide is we have multiple product support specialists, and we have WOC nurses that actually answer our phone lines through Me Plus. So if you are having a question or a concern and you need help, they are there to support you. If you are having issues beyond that, we do provide telehealth as well, if need be. So our program is very broad and inclusive. It includes a lot of different opportunities for our ostomates. The other thing we have is we also have a blog and chat rooms. The one thing I can suggest doing, which is very important too, is find somebody with an ostomy. If you want to talk about what you're experiencing, many times you are not alone. So find somebody to talk to. We have different chat rooms and blogs that are on the Me Plus site. There are also in-person UOAA support group meetings, and there are virtual meetings. One of the other opportunities that you have through the Me Plus support is we actually have Ostomy Secrets as well. And Ostomy Secrets are a line of underwear, swimwear, and wraps to help you feel more secure as an ostomate. So with that being said, this is one of the wraps by Ostomy Secrets. And inside, there's actually a little pocket that you can tuck your pouch into. And these come in many, many sizes, colors, shapes. And this just happens to be one of the wraps. This is also a wrap. This is just a little lace. But there's underwear as well as swimwear. It's just really a nice option to have to help you feel secure and comfortable. All right. So ostomy support, ostomy resources and support. We have our Me Plus program through Convatec, which has a plethora of resources. There's the UOAA, the United Ostomy Association of America. Again, great resource. They have a lot of information, that they have meetings and person and virtual, and then there's a lot of information on their website. And then there's also the Wound Ostomy Continence Society, and it's a professional nursing society dedicated to expert healthcare and individuals with wound ostomy and continence concerns. So my professional society as a certified wound ostomy nurse is the WOCN. It's where we go for a lot of our information and to share. So, and with that being said, that is the end of our presentation. I appreciate your time and listening, and I will open it up for any questions.
All right. Well, thank you very much, Jeanean. And as she said, if you guys have any questions, please feel free to throw them in the chat. I did see one came through as you were presenting there. It's back to whenever you were showing how to apply the barriers and everything like that. Mm-hmm. Someone asked, what do you do, say, if the stoma output starts to come out as you're cleaning and changing? Like, do you have any tips and tricks or basically any info you have on that?
Sure. So the best time to change your pouching system, and I say the best, because if you have a leak in the middle of the day, it needs to be changed. You don't want to wait, is when it's the least active. So for many people, that's first thing in the morning when they get up because they haven't eaten anything all night long. You tend to have less output at that time, whether it be urine or stool. If you have output while you're trying to change things, I highly recommend setting up all of your supplies beforehand and having extra dry washcloth, paper towel, to help clean that area. So if you do happen to pass stool or urine before you can get your new barrier on, you can again wipe that area so it's clean and dry before you place it. And sometimes it happens. You start to put it down, you have to start over. But usually if you can just clean it again and have extra there so you can stay clean and dry.
Yeah.
Hopefully that answers your question.
Yeah, I would assume it did. Let me see here if anybody else has any other ones for us. I know a couple people were saying that they have nephrostomy bags and stuff, but they were thanking us for the information and everything like that.
Okay.
And I know a couple people were asking about whenever you're applying the expandable wafer again. If you don't mind, would you be able to basically show that again, just real quick?
The moldable?
Yes. Yep.
Sure. Absolutely.
Make you full screen so it's easier for people to see.
So with moldable, actually, if you hold it like this, you're going to roll, mold, and hold, and you're going to roll, mold, and hold all the way around. So this one I just took off again, so I'm going to actually hold it in front. It's easier to do with your thumbs and your fingers like this, but for demonstration, this is easier. So you actually want to roll and mold and hold. If you just press this back, it'll come back, and it doesn't actually engage the layers that are in this barrier, and it doesn't have the memory as well. So when you roll it, almost like a pie crust, you're going to roll, mold, and hold. when you get it, and it can be too big. So I'm going to try and get this really big so I can show you. So if you get this too big, it's okay, because when you go to put it down with your stoma, what you can do is, as this warms, it will actually roll back up next to your stoma. Throughout the day, as your stoma moves, this material will stretch and expand and contract with it. Unlike a cut edge, which is stationary, so moldable is a really nice option if you're having trouble with scissors. You can roll it back, and as long as you're the correct size, if it's a little too big, that's okay too. And then this, as this warms, it comes back up next to the stoma.
Perfect.
So, and that's moldable. So moldable is a great option for many people, but sometimes there's other things that we need. Moldable does come in a flat and a convex barrier. A convex barrier is just built up on the back. It's like kind of like a bowl shape to help with stomas that are a little bit more flush or retracted. So.
Perfect. And looks like we got a couple more questions here for you. So someone said that they were using Natura pouches, and they're having a little issue with the Velcro not sticking. So they're asking if there's an alternative that you would suggest instead. So
pouch end like this is with these. This is our Natura pouch, and this is actually one of the pouches. So this one's a transparent. There's little hooks and these are plastic. So when these roll up, okay, if you pinch, you should be able to feel it, and you should be able to hear it when you go across. You should be able to. So this is the newest Natura closure. So you should be able to feel that going across. This little pocket here, you actually flip it, and it can tuck everything back. So if there's concern about that maybe not being closed or having something on it, then you tuck it back. It does not change the volume of the pouch itself. It just tucks the tail back. So in order to make sure it's closed, you just want to make sure that it's rolled all the way up, and then you can pinch it, and you should be able to feel it and hear it. If it's more of the cloth Velcro closure, that's actually an older pouch. We don't manufacture those actually anymore. We've moved to this. I would say if that's the concern, then call Me Plus and have them send you some samples, because that would be the best thing to do. If somebody's not currently registered, it's not hard to register. You can go to the website, or Jordan actually has some information on Me Plus that he will share at the end here, and there is a number that you can call.
And actually that led into my next question that we had from Robert here. He was basically just asking if he's a customer of ours, if he's automatically enrolled in Me Plus. So you do have to sign up for it, correct?
You do have to sign up for Me Plus. They will, once you do that, they'll reach out. They'll ask you some questions to start with, because we want to make sure that we're in the correct products. And then we also want to make sure that our product support specialists are leading you down the right path to what's maybe going to work best. So the first phone call, expect that there's going to be a lot of questions asked, because we want to make sure you're in the right products. Just because you're in a Convatec product doesn't automatically sign you up for Me Plus. Once you do sign up for Me Plus, they will call you, walk through that list of questions. They will send you samples and do a follow-up phone call. If things are all good, they won't reach out necessarily again. Once somebody's enrolled in Me Plus, though, however, and they're having issues, and let's say it's 2 or 3 years down the road, once you're enrolled in Me Plus, you're always enrolled in Me Plus. You just need to call that number and walk through what your issue is, and they can resample products. And again, it's all complimentary. You are not charged for samples.
Perfect. I think that should answer Robert's question there. I see another one here. Now, I don't know of one. They said that they have an oval-shaped stoma, and they're asking if there's some sort of measurable tool to make an oval shape. They've just been doing it themselves.
So a measure guide.
Yeah.
So they're all pretty much round. What I've done is I've actually taken, I'm just going to pull apart my measure guide here. A little trick that I've used, because they don't make oval measure guides, is you have to almost create your own. So I'm just taking apart my measure guide here, and I'm trying not to rip it too much. There we go. So what you can do is, if you've got an oval stoma, depending on the size, get the top and get the bottom, and you're in the middle here. So depending on what size you need for oval, you can take these apart and create the size you need. Once you create the size you need and you trace it on the back, you can a lot of times save this backing as a template to make sure that it's the same size. So the next time you go to change, you can use the backing that was on this one to make sure it's still the same size. If you're finding that your stoma is changing in size a lot, then you would want to do again where you would take apart your measure guide and create an oval. Unfortunately, we do not have oval measure guides.
All right. And then I see another one here. Someone asked if they have their wafers pre-cut and have like a template of their stoma, or I'm sorry, if they have a template of their stoma, and are they able to send it to you to get their wafers pre-cut, or is it more so just getting the measurement and then?
So depending on the product, there are pre-cut SKUs that we have in our product catalog, but we do not custom cut. If it's a size that we don't have. There are some DME companies out there on occasion that do still will cut to a different size. Unfortunately, I'm not sure which ones those are anymore. There used to be more of it, but they do still have some. So, but we do not pre-cut. We have SKUs that are pre-cut, but we do not pre-cut to unique sizes.
I think that was all the questions that I see here. So we're going to try something new here that we've never done on the webinar before. So as Jeanean was talking about, we have a couple of different handouts. One is for the Me Plus service program. It's a brochure on it. And then the other is an application card for the Esteem Body line of Convatec products. I'm going to try and hit share here. Everybody in attendance right now that is live should be able to download it. If not, I will attach it to the email that we'll send to everybody in the replay later today. So I hit it share now. If you're able to download it, then great. Like I said, if not, then I will certainly be sharing it later as well. So both of those should be shared with you guys. So if you are still here and want to get more information, please feel free to download those. And once again, we'll send them out later as well. If you're not able to, or if you're watching this later on, you're not live right now, we'll send it along with the email as well. Okay. Yeah, I think that is all that we got. Was there anything else that you wanted to touch on at all, Jeanean?
Thank you for your time today. I appreciate you spending the time with us today. Yeah,
absolutely. And thank you so much for being on here and presenting this to all our customers and everything and giving them more information on Convatec's products and their programs and everything like that. We truly appreciate it.
Thank you.
Alrighty. Well, that will do it for today's webinar. I feel like I keep repeating myself, but once again, we'll have a replay of this on our YouTube later today, and all the files will be sent out to you guys who signed up for it or were in here live. And for that, we'll see you guys next time. Thanks so much for joining us.